There's a lot to break down with this vaccine and the rollout plan. So for that, we turn to our experts. We have NBC's Tom Costello, NBC News medical contributor, Dr. Vin Gupta, and CNBC senior health and science correspondent, Meg Tirrell. Good morning to all of you.
Good morning.
All right, Tom, let's start with you and talk about today's meeting between the FDA and this advisory committee. What happens at this meeting and what can we expect to come out of it?
So this is an outside panel of 15 experts. They are MDs and PhDs and lawyers, and really their job is to look at the data and determine whether it meets the criteria for emergency use authorization. That's not the same as the same bar for a normal FDA approval. This is for emergency use, and we expect that they are going to say, yes, we advise to go ahead. The FDA then, within 24, 48 hours, they will decide we expect to go ahead as well. And once they do, we've talked to the commander of Operation Warp Speed. Within 24 hours of that FDA go-ahead, we expect the trucks will start rolling. Now, here's what's interesting. The trucks will roll out of the Pfizer distribution centers, their freezer farms that are in Michigan and Wisconsin. They will be, we expect, under police escort in big trailers, UPS and FedEx, taking these freezer shipments down to their hubs in Memphis and Louisville, and then loaded onto their cargo planes for distribution across the country. And keep in mind, we're not just talking about going to big cities. We're talking about the furthest outreaches of Alaska and into the swamps of Louisiana. I mean, this is a massive distribution challenge to be able to reach every point in the country and every territory as well within 24 hours and keeping these ice boxes appropriately cold. They believe that they've got the plan in place. You're not going to see military trucks on the road. It's UPS and FedEx cutting the country in half. FedEx takes the west, UPS takes the east, all part of a coordinated effort to expedite all of these shipments. And interestingly, we talked to UPS yesterday, and they said, yeah, you know what? Our vaccine shipments are going to be prioritized, but on the same trucks carrying your holiday gifts. They say that's not going to be a problem. They expect they can handle all of that appropriately.
All right, Tom Costello, as always. I will say it seems like every morning we're talking about coronavirus, so at least today it sounds like we're making some progress.
Finally. That's right.
Thank you, Tom.
All right, Tom, thank you. Now let's turn to Dr. Vin Gupta, who's been treating COVID patients from beginning out in Seattle. Dr. Gupta, good to see you. Officials in the UK warning people who have a history of significant allergic reactions not to get the vaccine. And this morning, FDA Commissioner Stephen Hahn told Savannah, quote, our label around the vaccine will not just say who should get it, but also who shouldn't receive the vaccine. So what more do we know about that? And is this unusual?
Good morning, Al. What we do know is that there was 2 cases in the UK, healthcare workers who had severe allergic reactions to the Pfizer vaccine. These appear to be highly unusual and very rare, but they are concerning, which is why whatever guidelines are issued in the product insert for these vaccines will likely make the exception for if someone has had a prior severe allergic reaction. So if they carry an EpiPen or an adrenaline shot with them, something like that will likely be the exception to the norm, which is this is a vastly safe and effective vaccine. So I think we just need to be cautious to the American people that there might be some rare exceptions here, but for the vast majority of individuals, this vaccine will be safe and effective.
Now, Dr. Gupta, as an ICU doctor on the front lines, you've seen firsthand what this disease has done, and yet we're hearing about people being hesitant about taking the vaccine. What would you say to those folks who are saying, yeah, maybe I'm going to wait?
Well, I'll say that in the course of treating patients, what my colleagues and I have seen all the way back to March is that individuals as young as 18 to those as old as 88 can end up in the ICU with a variety of symptoms. Those from stroke-like symptoms from a blood clot to severe pneumonia, and you end up on a ventilator. So no one is safe from this virus. You can't take it lightly, and you can inadvertently get it from somebody who's asymptomatic, even if you're healthy. So it's really vital that the vast majority of Americans for whom this is going to be safe and effective for receive the vaccine.
All right. Dr. Gupta, thank you so much. Dylan?
Now let's bring in CNBC's Meg Tirrell. Meg, I want to ask you how this rollout is going to happen. I mean, we know that FedEx and UPS can do next-day delivery, but is distribution going to happen that quickly? And how do they decide which state gets how much?
Yeah, so as Tom was outlining, Operation Warp Speed has said they are ready to go within 24 hours of the FDA giving emergency use authorization, and they have to get all over the country. And they say they're going to deliver to all the states and territories. There are, though, guys, 2 jurisdictions in South Pacific Islands, apparently, that don't have the cold storage they need for the Pfizer vaccine. So they won't get it immediately. But otherwise, 636 different locations have to be shipped to based on the state's orders. And we're told that the allocations were made based on the state's population. So big states like California, they get the most doses, 327,000 doses in their first shipment. Medium-sized states will get, 50,000 doses, like Maryland. And smaller states, in terms of the numbers of people they have, like North Dakota, well, they get less than 7,000 doses in that first shipment, guys.
I know I just received the email that if my son does not get the flu vaccine, which he's already done, by the end of the year, then he can't go to school in January after winter break. Are schools, are companies going to require that employees and kids get these vaccines?
This is a major debate that's going on right now. And what I'm hearing from folks is that it could be complicated. It's not illegal, but what we're expecting is, as Tom was saying, perhaps emergency use authorization from the FDA. And that is slightly different from full approval. It doesn't mean the vaccine is less safe. It just means something different legally. So it could be difficult for employers really to mandate this on emergency use authorization. As for schools, this will be a question that perhaps we'll be asking next fall, because Moderna has just started testing its vaccine in kids ages 12 to 17 with the hopes that at least for middle schoolers and high schoolers, a vaccine could be cleared for them for back to school next year.
Wow.
So much to discuss. Meg Tirrell, Dr. Vin Gupta, Tom Costello, thank you all so much for such great information.
Moving forward.
Yeah.
You know what I mean? Seriously, it seems like sometimes we sit in this chair and it's just
same thing
the
day after
same
day.
thing. So at least, we're making progress.
But a vaccine is different than vaccinations.
You're right.
They are.
Exactly.